Hi, my name is Emily Woolhiser, and I'm a fourth-year medical student currently applying for residency into dermatology from Kansas City University. And I got to work with Dr. Dellavalle from University of Minnesota's Department of Dermatology on our paper entitled Nutrition, Obesity, and Seborrheic Dermatitis, a systematic review that was published in JMIR Dermatology. In our paper, Nutrition, Obesity, and Seborrheic Dermatitis, we wanted to explore the role of nutrients in diet, whether adherence or supplementation or deficiency with certain nutrients in diets had to do with either aiding in seborrheic dermatitis to continue to overgrow or with helping go towards its resolution. So we looked at it through the proposed pathogenesis of seborrheic dermatitis. There's a lot of contributing factors, but some of the main ones we explored were increased lipid secretion, overgrowth of fungus like malassezia, and an increase in inflammatory response that would result in skin barrier disruption. And each of those pathways could be modulated by the diet, obesity, and nutrition supplementation. So we structured our search around that. We were able to include 13 different studies that totaled to almost 14,000 patients. So definitely a lot of people to examine. Some big findings that we found from that are that some nutrient levels that are seen increased in seborrheic derm include copper, manganese, iron, calcium, and magnesium, whereas those that seem to be consistently decreased in those patients with seborrheic dermatitis included zinc, vitamin D, and E concentrations. There were some studies that talked about patients that had mostly a Western diet consisting of a lot of starchy or oily foods. And there was a correlation seen between female patients adhering to the Western diet and their incidence of having seborrheic dermatitis, although no statistically significant correlation was seen with male patients. And as we know, male patients are the more targeted population of seborrheic dermatitis, so that was an interesting find. We also saw that patients who had increased consumption of fruit in all types of patients, not gender specific, had a decreased risk of seborrheic dermatitis, so could have to do with the nutrient abundance in those fruits. One specific thing we found was with a prebiotic called Triphala, and in that study, there was improved satisfaction with patients and decreased scalp sebum levels over the 8-week span of using it. We did not find direct studies that had a direct cause showing regular alcohol use and obesity and high BMI had to directly correlate with seborrheic dermatitis. What we found is largely doing these types of diet-based studies or nutrition studies do have recall bias associated with them, so it's hard to necessarily delineate a specific outcome from testing that, which makes it difficult to say. Obviously, seborrheic dermatitis has sort of a loaded pathogenesis, a lot of attributing factors, and definitely more studies would be needed to make these recommendations. However, with what we found, it would be interesting to see if supplementation with vitamin D, E, and zinc could help those seborrheic derm patients who might not have had luck with traditional therapies like antifungals and corticosteroids, or just might not want to be on them for a significant amount of time, as those therapies obviously come with side effects. We chose JMIR Dermatology for publication because we wanted this paper to be accessible and read by as many people that could see it and access it, and having an open access journal that has such a high impact factor and influence in the field of dermatology is so important when looking to publish research. And for this paper specifically, the topic of nutrition and its relation to skin conditions of any sort is such a huge topic that patients come in and ask, but also largely discussed on social media. And I think that JMIR Dermatology does prioritize really aligning their articles and what they publish with what is in the general topic of talk and conversation across social media. And with that, we obviously wanted something that could be accessible to physicians and patients as well, so that these myths that people talk about can sort of be debunked just by having a readily accessible paper that has peer-reviewed scientific research backed and can help everyone with whether they're treating seborrheic dermatitis or have suffering it as a condition. So we're so happy with JMIR Dermatology and just very honored to be published in this journal and given the opportunity to talk about it in this video format.